I'm the director at Women's Health Specialist, Feminist Women's Health Center of California.
Yay!
This is Shauna Heckert, our Executive Director of Women's Health Specialists, and I want to thank Kathleen Williams for getting us on the panel with others, and also for your decades of activism in change for women's health, and Paula's support as well. We not only support Occupy movement, we're part of the Occupy movement. And I think there are other women's groups, I know there's other women's groups that would want to be part of Occupy, and we would be happy to help bridge that gap and bring in other women's groups as well. Women's Health Specialist is 37 years old, and it might be hard to understand the historical significance of the bold and defiant act of starting a women-controlled clinic. We offer all pregnancy options. We help women with all women's health services, from pregnancy testing, abortion services. We have an adoption program. We have prenatal referrals, support midwives, all methods of birth control, and testing and treatment for sexually transmitted disease, as well as breast screening, breast self-exam. And I think one of the things that's most inspiring about our story is that we didn't ask permission. We assessed the situation in 1975, starting in Chico, and we took our own turf, and we made our own women-controlled institution. Our vision is lofty, but it's grounded in our practical, realizable goals. Our mission today is the same as it always has been. We have a vision, a world that is dedicated to providing women-controlled health care and advocating all options for all women. Our dreams are big. We're more than a clinic. We're activists for social change and for a model of health care. And we'd like to share today a really important perspective on reproductive oppression. Reproductive oppression affects the lives of women's lives in multiple ways, and we see our role as shining a light on reproductive justice. A multi-pronged approach is needed to fight exploitation and to advance the well-being of women and girls. So here's the three frameworks that we can carry forward in our minds. Reproductive health deals with healthcare service delivery and access and safety. So in terms of when we started our clinics, we're also among those offering reproductive health, and that's addressing an important piece, but it's a piece. Reproductive rights addresses the legal issues and encompasses legal protections for women. And we've also had a role in that, and there are many other reproductive rights organizations. Reproductive justice recognizes that reproductive oppression is the result of the intersection of multiple oppressions, and it's inherently connected to the struggle for social justice and human rights. Women of low economic means suffer consequences from the lack of access to complete health care. So reproductive justice focuses on movement building and deep social change. So having clinics right now makes women's lives better right now, but it's not enough. We're going for the deep social change. We want to change power relationships through the women-controlled healthcare model. We began the movement to take control and learn from our own bodies. We had a lack of information about how our bodies work normally, and so our process has been to demystify and demedicalize women's bodies, normal, healthy women, and to perform women-controlled research. The road to women's liberation starts with decolonizing our own bodies. Yeah. This is what we call self-help. Around the world, every country you go to, they understand population control strategies to reduce and eliminate the population, and specifically to reduce populations of third world countries, with the myth that people are going to do better economically automatically by having smaller families. It's not true. Why in this country are people not recognizing population control strategies? And we expose those And when you have the women control and women guided strategies and women guided communities, we throw that over, we oppose that.
Thank you.